Hi everyone, welcome back to Beyond Your Knowledge. Today we're going to be studying vitamin B12 deficiency. So we're going to see some few good things. But before we continue, let's just read Luke 6, 35 to 36. Says, but love your enemies and do good and lend, expecting nothing in return, and your reward will be great, and you will be sons of the Most High, for He is kind to the ungrateful and the evil. Be merciful, even as your Father is merciful. So God calls us to be merciful. Amen. Cool. Let's put this in green. Okay, now vitamin B12 deficiency. So there are several causes of vitamin B12 deficiency. Well, it could be poor nutrition or problem with the absorption of the vitamin B12, or could be a problem with the intrinsic factor, with other things. But we are going to focus more basically in the pathway. So how this happen and what is the consequences of this. So for example, if you have methylmalonic acid, okay, so we are going to see here methylmalonic acid. So this methylmalonic acid need to go to a place. So where do you think that is going to go, this methylmalonic acid? So this methylmalonic acid need to go to methylmalonyl CoA. Methylmalonyl CoA. So this methylmalonyl CoA needs to go to another place and go to succinyl CoA. Go to where? Succinyl CoA. Now you need an enzyme to convert this methylmalonyl CoA to succinyl CoA, and the enzyme is called methylmalonyl CoA. You still have to, you keep the name, but it's called now the enzyme mutase. So, and then this require a vitamin, and the vitamin that required is vitamin B12. So that means that you need vitamin B12 to work with methylmalonyl CoA mutase to convert methylmalonyl CoA to succinyl CoA. Now, if you have a problem, and if you have a vitamin B12 deficit for any reason, so this vitamin B12 is not going to be working anymore, and then so you're going to have methylmalonyl CoA becomes high, so your methylmalonic acid becomes high, and then so this methylmalonic acid is going to build up. So if that building up, so the patient is going to have an impaired. So we should do this in red too. So the patient is going to have an impaired myelin synthesis. Got it? And then so the patient for this reason is going to present with numbness. So the patient can present with numbness, with tingling, all those. Okay. Now, this is in the site of the methylmalonic acid. But what about if we talk about of homocysteine? Because homocysteine also, we're going to open a new slide. So homocysteine also require vitamin B12. So we have homocysteine. So this homocysteine is going to be methionine. Okay. So, and now what is the enzyme that you think that we're going to be using here? So methionine synthase. So the enzyme is called methionine. So probably it should be methionine synthase. Okay, so this one require which vitamin? So vitamin B12. Got it? But also, here is a process so that we have, because there is another thing that is going to work here with us, and this is called the methyl tetrahydrofolate. Which one? So methyl tetrahydrofolate. So that we saw in another video, the methyl tetrahydrofolate. So when we are conversion of the folic acid to tetrahydrofolate go to 510 methylene tetrahydrofolate, and yeah, so then use the enzyme methyl tetrahydrofolate reductase using B2. Okay, and then yeah, so then you have your 5-methyl tetrahydrofolate. But in here, in this, that was with the folate cycle, but now here come back again to homocysteine. Yeah, so in this homocysteine, so you go to this methyl tetrahydrofolate can go to tetrahydrofolate. Tetrahydrofolate, which is abbreviated THF. Now it is very interesting because this is the normal. This is what's happened with that. If for any reason this vitamin B12 is not working, so you cannot work with methionine synthase, so you cannot give neither methionine neither tetrahydrofolate. So that means that homocysteine and methyl tetrahydrofolate, those two, they are going to build up, and then the patient is going to have impaired, so because they're going to be high, so impaired DNA synthesis. Okay, so that means the patient is going to have this DNA synthesis impairment. Okay, got it? So now I'm going to just mark with gray the one that is not going to be working anymore if you have vitamin B12. I mean the one that is should be this one. Okay, so tetrahydrofolate is gone, and then methionine is gone, and then US build up, and here in the other one succinyl CoA is gone, and yeah, so basically it's that. Well, so with that in mind, we can just give some more details. So remember that this vitamin B12 is a cofactor. So vitamin B12 is a cofactor for the enzyme methylmalonyl CoA mutase that we saw before. So methyl is a cofactor, methylmalonyl CoA mutase. Okay, which is in the conversion of methylmalonyl CoA to succinyl CoA, and this reaction occurs in the breaking down of all chain fatty acids and some amino acids. As a result, some patients with the vitamin B12 deficiency have elevated methylmalonyl CoA levels, as we mentioned, that subsequently results in a build-up of neurotoxic methylmalonic acid, which is this one here. And then the symptomatic consequences is lethargy. So in addition to those that we mentioned, let's just say also the patient is going to be lethargic. The patient is going to have seizure, paresthesia, hypotonia. Seizures, hypotonia, and paresthesia. Okay. While the homocysteine is elevated in both, so homocysteine is this one here, is going to be elevated in both in vitamin B12 deficiencies and vitamin B9. So this one, folate, let's just write it here. Folate and B12 are elevated with the with homocysteine deficiency, with homocysteine. Actually, no. Folate and vitamin B12, if they are deficit, okay, yeah. So it should be deficiency. There we go. Deficiency of folate and vitamin B12 cause now elevation. Yeah, I was writing, I was thinking in one way when I was writing the other. Cause elevation of homocysteine. Now it sounds right. Yeah, and this homocysteine is elevated in both folate and vitamin B12 deficiency, but the methylmalonyl-CoA mutase is just only B12 deficiency. Okay, yeah, there we go. So I think that with that in mind, so we can take a break here, and thank you so much for watching, and remember that we can do all things through Christ strengthens us. If you have any questions, just keep it touch. God bless you, and God bless.